Craniocervical instability in Down syndrome. Down syndrome, DS, also known as trisomy 21, is a condition caused by the presence of an extra chromosome, chromosome 21, which results in atypical physical and cognitive development. Development of secondary health issues such as craniocervical instability, CCI, are common within the DS population compared to the general population. Instability of the C0, C1 and C1, C2 joints occur due to malformation of the axis, C2, specifically the dens and/or laxity of the transverse ligament caused by collagen defects. Both of these structural anomalies allow increased translation of the posterior aspect of the atlas. CCI can be subdivided into occipito-axial instability, OAI, also known as atlanto-occipital instability, AOI, and atlanto-axial instability, AAI, affecting 17.5% and between 6.8 to 30% of people with DS respectively. Occipito-axial instability, OAI, is less researched in the DS population compared to AAI. Bony abnormalities such as undeveloped occipital condyles and superior articular facets of C1 can cause such instability due to decreasing joint congruency. Ligament laxity has been cited as another explanation for OAI, specifically retropharyngeal ligament laxity. Atlanto-axial instability, AAI, is defined as an increased distance between the posterior aspect of the frontal arch of C1 and the anterior aspect of the dens, otherwise known as the odontoid peg, of C2 when measured on radiographs taken in the neutral position. It can occur as a result of increased movement at the atlanto-axial joint, the atlas and axis joint articulation. The instability arises from bony abnormalities and ligament laxity of the atlanto-axial joint. Atlanto-axial instability in Down syndrome. Occipito-axial instability, OAI, is less researched in the DS population compared to AAI. Bony abnormalities such as undeveloped occipital condyles and superior articular facets of C1 can cause such instability due to decreasing joint congruency. Ligament laxity has been cited as another explanation for OAI, specifically retropharyngeal ligament laxity. Occipito-cervical instability in Down syndrome. Symptoms associated with AAI and OAI include neck pain/discomfort, myelopathy, abnormal head posture, abnormal gait, change in sphincteric control, decreased neck range of movement (ROM), frequent falls, increased fatigue on walking, differential diagnosis, cervical trauma, cervical canal stenosis, cervical ligament injury, cervical radiculopathy, cervical spondylosis, degenerative disc disease, disc herniation, juvenile disc disorder, torticollis,